Welcome back. Well, tonight we turn our attention to a critical medical condition that can strike suddenly, hypovolemia or low blood volume. Now, it occurs when the body loses too much blood or fluid, leading to a drop in circulation and oxygen delivery to vital organs. But to help us better understand its causes, its symptoms, as well as treatment options, we're joined by Dr. Youssef Saad. Doctor, good evening and welcome.
Good evening. Thank you very much for having me.
Thank you so much for being here.
Thank you.
Of course, I gave the ChatGPT version explanation of what hypovolemia is, but in your own words and very simple terms, explain what this condition is.
Okay, thank you very much. The hypovolemia is a state where the body, as you correctly said, or as ChatGPT said, that the body will lose volume of the circulating blood. Our blood is made of 90% water, which we call it the plasma of the blood, and then 10% cells. So if somebody is losing blood as a whole blood, or losing the water in the blood, then we come into a status where we call the patient or the person to have hypovolemia. Hypo is a terminology in Latin, means low, and volemia is volume. So it's a low volume of a circulating blood. The condition is common to happen after somebody is having an accident, for example, losing some blood, and that is a critical situation. We had a couple of weeks ago a very important advanced trauma life support course, which is one of the most advanced management courses to train doctors, senior ones, how to manage those cases when somebody is having an accident and then bleed critically, that they are rescuing him and saving the life. And that was a very big advancement to have this course for the first time in the School of Medicine in UNAM. It was a couple of weeks ago, and that was very well attended course. So coming back to our reasons, if somebody is bleeding, losing blood, and that can happen in a quick phase, like somebody is having a wound and then the wound is bleeding, or it can happen on a long term. So somebody is having an ulcer in the stomach who is vomiting blood, small amounts but regularly. Somebody is having a condition which is causing loss of blood from the stools, for example. It can be causing this to be depleting the volume slowly but surely. Ladies who are having very heavy menstruation, a lady who's having ectopic pregnancy, which burst inside, cause some bleeding inside, that can cause hypovolemia. But that is losing the whole blood. And there are some conditions which are also quite common for somebody who's not losing blood, but also having hypovolemia.
Okay.
And that is very interesting, and a lot of people don't know about this. So a mother who's having a child who's having diarrhea and vomiting for a couple of days, the child is losing a lot of volume from vomiting fluid and also passing a lot of diarrhea fluid. So that will be bringing the child into hypovolemia.
Not dehydration.
It is dehydration, but the dehydration is loss of water. And as I said earlier, loss of water is also loss of volume. And if that is happening without a replacement, that is dehydration, which can cause hypovolemia. And somebody who's having in summer, and we are going into the summer season, somebody who's having a trip or going into a sunny environment, not paying attention to drink enough water and replace the fluid, can get into a degree of a sunstroke, and that is again hypovolemia, losing volume as well.
When you talk about signs and symptoms, I think obviously if you've had an accident, you're hemorrhaging, you've had an ectopic, pregnancy loss, etc. Those are the very obvious cases. Sometimes people don't even know when they have a stomach ulcer, and you mentioned that's one of the ways that you could also be losing blood slowly but surely. But then what should I be looking out for to alert me that something could be wrong?
Thank you very much. It's a very good question. So there are some signs and some symptoms. Signs means a doctor or somebody who's doing examination will detect it. But symptoms is somebody who's complaining of. So the symptoms, which are the first thing, because people need to be alerting that I have the symptoms, so I can go and seek medical advice. So somebody who's having fainting or dizziness unexplained, somebody who's not able to be energetic as used to be, losing power, not able to work, not able to stand for a long time. some person who's already fainting, losing conscious and so on. So those are an early signs. Somebody who is looking pale, you are not feeling like vivid as supposed to be. So those are the common symptoms. And then the signs is if we detect that this person blood pressure is dropping, if we detect that the person heart rate is fast, and that sometimes people who are quite sensitive, they feel like, I feel palpitation, I feel like my heart is beating fast. Obviously somebody who's having a low iron, so if we test, we find that the volume is low. Those ones are early signs and symptoms that somebody is having loss of volume. If we are speaking about loss of blood, sometimes there is what we call, and that is a common test which people can learn to do it for themselves and for their relatives. We call it a delayed capillary refill.
Okay.
If I press on my nail bed, then there will be whitening, or we call it blanching, that it will be white.
Yes.
If I remove that pressure, the pinkish color should be coming back in less than 3 seconds. If there is a delay of that, we call it capillary refill. That is a sign that the volume is low and the blood pressure and the blood volume is a bit low. So these are the common signs and symptoms. And obviously, the moment somebody is going to a clinic, then we check the pressure and we check the parameters and we check the heart rate. Sometimes we put other investigatory things to discover where is the blood.
Well, from what you've just explained, Dr. Youssef, sometimes I think people go to, and they do feel, they get this dizzy spells and all of that, and we put it down then again to low blood pressure, and perhaps not investigating further to see that the individual's not hypovolemic. But now what happens when, in that case, you've gone to the doctor's put it down to just low blood pressure, maybe even lack of iron, and you get medication for that? What dangers, are there if this is not treated quickly?
Yeah, coming back to your question, there are two overlapping parameters. So hypovolemia will eventually cause a low blood pressure. But when we speak about the early phase, then it's not necessarily reflecting in a low blood pressure. But low blood pressure means the volume of the blood is probably low. And anemia means somebody who lost iron or lost blood. So that is also correctly a sign of a hypovolemia.
So low blood pressure and maybe low iron should be an indicator that it could possibly be hypovolemia.
Exactly.
Right.
But the only caution here that it is usually a slightly late sign. So we don't want to wait until somebody is losing blood to the extent that he's dropping the blood pressure, because that is an advanced status, which means that the treatment is slightly delayed. So a person with a hypovolemia, the first reaction is we have a high heart rate, so the heart start to be beating faster, and then the respiration become faster, and then people will start to become feeling a little bit agitated. We have 4 phases or 4 different categories where people of hypovolemia pass through. The first one is when I lose only 10% or 15% of the blood volume, and that is what we call it physiological status. So that is basically for audience to know if somebody is going to donate a unit of blood. Then I'm going to lose 10% of my circulating volume. I usually, as an adult, have 5 liters of blood. So if I lose 10%, which is 1 unit of blood, usually 500 ml, that is not supposed to be causing me symptoms. So that is, we call it physiological, means our bodies are ready to compensate for that loss of volume without causing any signs of symptoms. If I go into the phase further, which is losing 15 to 30% of the blood volume, I'm speaking here about 750 mils to up to 1,500 liters of, 1,500 milliliters of blood, a liter and a half. That will be starting to showing some signs and symptoms, which I just mentioned. So the respiration will become fast, and then the person will become agitated. You feel dizzy, you feel sweaty, you look pale, and people are lacking energy and so on. The blood pressure might not have changed at this stage.
Right.
So we are losing a lot of volume, yet the blood pressure is not dropping.
Right.
And that is what I just mentioned to you. By the time I'm waiting for the blood pressure to drop, I'm already into deep troubles.
Advanced stage, yeah.
The stage 3 is when I lose more than 30%, more than 1.5 liters. And only then the blood pressure will start to drop. And only then, you know, the body is looking very, and then the conscious level is going to be gone, and the person will become collapsy and loss of conscious and so on.
Got it.
That is a very advanced stage of hypovolemia, and that is what we train nurses and doctors to say. Don't wait until you see the patient into that phase, because by that stage you are already too deep, and the patient is already in troubles.
Dr. Youssef, let's quickly talk treatment options for patients that have hypovolemia.
We have a principle to say, number one, I need to discover where I lose the volume, because I need to stop the loss and replace what I lost.
Right.
So for me to stop the loss, we need to look for where the leakage of volume is happening. If it is leaking of water, it's usually like obvious sunstroke or dehydration or gastroenteritis or something like this, then we need to rehydrate the system. But if it is loss of blood, which is common to happen in trauma and accidents and so on, we always speak about 5 potential places to lose. And we teach doctors to say on the floor and 4 more. On the floor means something external, obvious bleeding, which anybody will see that the blood is trickling on the floor. And the 4 more should be in the body cavities, which may accumulate bleeding, which we call internal bleeding.
Right.
That can be into the chest cavity, into the abdominal cavity, into the bones of the pelvis, where there is a fracture of the pelvis, then it can accumulate a lot of blood there, and into the long bones of the lower limbs or even the upper limbs. Even a closed fracture, which is not bleeding to the outside, can be accumulating a lot of blood around. So the idea is I need to find where is a bleeding point, and medically I need to correct it by stopping the bleeding. Then I will replace volume by giving first 1 liter of fluid intravenous, and then we give a unit of blood, and then if that is not enough, then we need to initiate what we call it a massive resuscitation or a massive blood transfusion, where we need to give the patient more blood and more volume.
Doctor, are there specific groups of people who are more vulnerable to this condition? Children, elderly people, for example?
Yes, very correct. So we know in physiology extremes of age, like children and very elderly people, the physiology is not very active, so they don't compensate quite well.
Yes.
And they are suspected to hypovolemic shock. Then they are going into the stage 3 and even stage 4
Right.
in a very quick, short time. But also people who are not doing well before. So somebody who's having a heart condition before, somebody who's already anemic before, like a lady who's having an issue of losing blood regularly, if she is suspected to a sudden trauma and bleeding, then the reserve is not there.
Of course.
People who are having immune problems like kidney problem, kidney failure, diabetics, people who are having previous strokes, and the brain is not very well vascularized and so on. So all those groups are not compensating quite well. Pregnant ladies having a lot of circulatory issues. So if they lose volume, they are in trouble quite quickly. And if they are in trouble, we have 2 lives at the edge, because it's a mother and the baby as well.
Yeah. Dr. Youssef Saad, I don't know if they've told you you're an incredible teacher. That was so informative. Thank you so much. I appreciate it.
I
we
really
appreciate your
comment.
time.
Thank you.
Well, it's almost time to say goodbye. We'll be right back. Stay with us.